Hi everyone, I have Megan and Claire here with me today and they're just going to give you a little chat about their independent mental health IMHA role. They're going to talk about how they support people under that role and what impact we've made. So I'm going to hand you over to Claire and Megan.
Hi everyone, as an IMHA we support people who are detained in a hospital setting under the Mental Health Act 1983. And the law says they're entitled to a free, unbiased support from an independent advocate. So that's why we get the referrals in from the hospitals. And we're here to make sure that their rights are being upheld and support them in lots of various ways, actually.
Yeah, so we support people who are detained under a Section 2, a Section 3 and also a CTO in hospital. Some of the things that we can do to support people under their section is supporting them to attend meetings. So that could be discharge planning meetings, multidisciplinary team meetings, and ensure that their views and wishes are heard by others and make sure that their voice is heard by others also.
Yeah, it's good to look at the situation they're in through their lens really, and the impact it has on them and their family. And it's often a scary time for people because it's maybe the first time they've ever come across anything like this. So it's really important that we can guide them and give them as much information as possible to support them, like I say, through this process, which can be a very upsetting time, and it can be a short stay for some people, but for some people they have quite delayed discharges due to there not being the right placements after they have been sections. Not everybody actually goes home, and that's quite upsetting to see sometimes, that we're like involved in the discharge planning. Is, you know, when you realise that actually somebody isn't able to go home, then you're working with social workers and external services to make sure that the discharge is safe and well planned and it's the right place for this person.
Yeah. And can you just give us some examples of how we have supported somebody during the IMHA role?
Yeah, so part of our role as IMHA is to make sure that a person is aware of what their rights are under the Mental Health Act. So that could involve making the application for a tribunal hearing where a person wishes to appeal their section under the Mental Health Act. So something that the IMHA can do is support the person to attend that tribunal, as well as supporting them to instruct a solicitor as well. So we can provide a list of solicitors and give people resources in order to contact the solicitor and arrange that initial visit so that they can speak to the solicitor and have some representation there as well, some legal representation.
A good thing we're doing at the moment as well is, like, Megan and I are here this afternoon to do the drop-in sessions. Now that's where we just basically have access to every ward up here at Carlton Clinic and go and introduce ourselves and talk about the advocacy role. Some people may have not been referred, some people may not know anything about it, so it's a really good opportunity to see the new patients, meet some of the patients that we're already representing. I feel like it's really positive because we get to meet the staff, and even some of the wards that we're not allocated to, we still have access onto them. We can see the type of people that we're supporting if we should get, you know, a new referral in. So it's really a good opportunity. I really enjoy these sessions.
Yeah, I do.
Yeah. Excellent. Well, thank you both very much, and yeah, thank you.